بسم الله الرحمن الرحيم. الحمد لله الذي أنزل على عبده الكتاب ولم يجعل له عوجا قيما لينذر بأسا شديدا من لدنه ويبشر المؤمنين الذين يعملون الصالحات أن لهم أجرا حسنا ماكثين فيه أبدا وينذر الذين قالوا اتخذ الله ولدا ما لهم به من علم ولا لآبائهم كبرت كلمة تخرج من أفواههم إن يقولون إلا كذبا. So let's start this 2 minutes video that will help you a lot in spotting elbow fractures in a child elbow vs in an adult elbow. Okay, so this is a normal adult elbow. You need to know that the anterior fat pad should be seen like this. Should be seen like this in an adult elbow, and the posterior fat pad shouldn't be visualized. So normally, in an adult elbow, the anterior fat pad should be visualized. However, the posterior fat pad shouldn't be visualized. Okay? So, in this elbow, if you see the anterior fat pad is visualized and elevated, it's not like this. It's elevated with sale sign. And the posterior fat pad, look, the posterior fat pad is visualized now, which is abnormal. Okay, the anterior fat pad is elevated and the posterior fat pad is displaced to be visualized. This means that there's something here is displacing this and making it elevated, displacing this and make it visualized. What is this? This is elbow joint effusion. This is elbow joint effusion. Okay. So elevated anterior fat pad as well as visualized posterior fat pad of the left elbow joint of a skeletally mature patient is a sign of elbow joint effusion. And here is a tip. If you see an elbow joint effusion, if you suspect an elbow joint effusion in an adult, look for radial head fracture, look for olecranon process fracture, because these are the most common elbow joint fractures in an adult that will be associated with elbow joint effusion. Okay, so in this case, there is elbow joint effusion, but I can't see any evidence of radial head or neck, and there is also no evidence of olecranon process fractures. Okay, I can't see any fractures. Okay, let's see this case. Another case. This is the anterior fat pad. It's not like this. It's elevated with cell sign. And this is the posterior fat pad, which is visualized now, and this is abnormal. So of course there's something here is pushing this and this to make it this elevated and this visualized. Okay, so this is elbow joint effusion. Elevated anterior fat pad as well as visualized posterior fat pad on the left elbow joint of a skeletally mature patient, indicative of elbow joint effusion. Think of fracture of the olecranon or fracture of the radial head or neck. There is no evidence of fracture of olecranon process or fracture of the radial head or neck. So what about this case? Oh, typical. Elevated anterior fat pad But I can see here the posterior fat pad. Okay, but there is evidence of elevated anterior fat pad with the sale sign indicative of left elbow joint effusion. I told you, once you see this sign, check for evidence of radial head or neck fracture. No evidence of radial head or neck fracture. Oh, but there is evidence of olecranon process fracture here. Okay. Now let's talk about the pediatric elbow. The pediatric elbow fracture. Okay. So in pediatric elbow, we depend on two signs. The first one is the anterior fat pad sign, but sometimes it can be masked. The anterior fat pad sign can be masked by the fractures here because the fractures in the pediatric elbow is not common here. It's common to be supracondylar fracture, a supracondylar fracture. So the fracture is more common here. So sometimes it can mask the elevated fat pad sign. So how to deal with this problem? Okay, don't depend only on the anterior fat pad sign. Depend on another sign, which is anterior humeral line. Anterior humeral line sign. Okay, so what is the normal? The normal is that if you draw the anterior humeral line like this, it should intersect the capitulum and the olecranon process in a certain way. It should intersect the capitulum at the junction between the anterior one third and the posterior two third, and it should intersect the olecranon process at the junction between the anterior two third and the posterior one third. So if you got disturbed intersection of the anterior humeral line, this is a sign of either elbow fracture or dislocation. So anterior humeral line is a sign of elbow fracture or elbow dislocation in a pediatric elbow. Okay, very important. Don't forget. Okay, so in this case, the anterior humeral line. Let's draw the anterior humeral line. Oh, where's the capitulum? The capitulum is here. Oh, what happened? Disturbed intersection of the capitulum. The anterior humeral line intersect the junction between the anterior, not one third, the anterior two third, and the posterior one third. Or you can say that it intersects the distal one third of the olecranon process. This means this is a sign of supracondylar fracture. Supracondylar fracture. The fracture here is above the condyles. So it is supracondylar. As you can see, this is the fracture, this is the supracondylar. You can see here the evidence of supracondylar fracture above the humeral condyles. Okay, so let's continue with the anterior humeral line. Oh, it intersects the olecranon process normally at the junction between the anterior two third and the posterior one third. So there is no evidence of dislocation here. Okay, so disturbed anterior humeral line intersection of the capitulum and skeletal mature is a sign of supracondylar fracture. Okay, the elevated anterior fat pad is probably masked by the fractured bony fragment, as I've mentioned. Okay, so the disturbed Let's see here, the anterior humeral line. It intersects the capitulum, where at its posterior aspect. All of the capitulum is here. Okay, so what does it mean? Supracondylar fracture. Okay, this is a supracondylar fracture. Okay, the anterior humeral line intersects the olecranium normally. So you can say the anterior humeral line intersects the capitulum abnormally. However, it intersects the olecranon normally. Disturbed anterior humeral line intersection, supracondylar fracture, no elbow dislocation. So there is a supracondylar fracture, yet no elbow dislocation. And there's the reason. Okay, what about this case? So the anterior humeral line here, as I've mentioned, we will depend on the anterior humeral line in the pediatric elbow. The anterior humeral line intersects the capitulum normally. Okay. However, it intersects the olecranon process abnormally. It doesn't intersect the olecranon process. It's not here. This is the process. Okay. So what does it mean? It means that the olecranon process displaced backwards. This means posterior elbow joint dislocation. So what we'll say here, the anterior humeral line intersects the olecranon normally. However, it does not intersect the olecranon process. This means posterior elbow dislocate the posterior elbow dislocation, yet no elbow fracture. That's it. Thank you very much.